Our News is brought to you by Alive.
Welcome to Our News and thank you for joining us. I'm Kyle Joaquin. The Ministry of Health confirmed an additional 97 cases of COVID-19 yesterday, pushing the country's total to 2,020. 1,221 of those cases remain active, while 742 have recovered. 82 people remain hospitalized, while 50 deaths have been reported, 10 of which are under investigation. And while healthcare workers are concerned over the capacity to handle this increasing number, Health Minister Rhonda Wells explained that more room is being made at Princess Margaret Hospital throughout various clinics as well as hotels to house COVID-positive patients.
Yesterday, the Prime Minister and I had the opportunity to tour the 62-bed facility that will be used to expand our capacity to care for COVID-19 patients in the East Wing of Breezes. Patients will experience soothing oceanfront garden views that can boost mental health. 18 patients can be accommodated on the first floor and 22 patient rooms, each on the second and third floors.
There are 746 active cases on New Providence, 239 on Grand Bahama, and 66 on Abaco. 1,139 are currently in home isolation. According to Wells, 114 beds have been added to the healthcare system, with 30 expected to come on stream soon. $10 million has been allocated for renovations at PMH and $21 million for RANT Memorial Hospital.
For the COVID-19 response, there are 10 beds at South Beach Urgent Care and Referral Center, 16 beds at the Cancer Association of the Bahamas building in Freeport, Grand Bahama. 4 beds are available in the Legacy Unit of the Princess Margaret Hospital, 10 beds in the Old General Practice Clinic in PMH, 18 beds currently available at the 62-bed National Response Facility at Super Club Breezes Resorts, 21 beds at Doctors Hospital West.
Now, the integrity of the daily dashboard has been called into question, where in some cases it was released the next day, had inaccurate figures, or used the word pending in some categories. Chief Medical Officer Dr. Pearl McMillan explained sometimes there are challenges with data management and gaps.
That is why you would see pending. When we get information that comes into the surveillance unit that has those kinds of gaps, we will have to reach out to those individuals, one by one, and seek to get the information that is required to populate the dashboard.
There is also the disparity in the classification of deaths, which continues to increase. According to McMillan, there is a new classification to help remove any room for confusion.
But what we have done by adding the box that looks at deaths under investigation is to remove the 10 deaths which are currently under investigation out of the 50 deaths yesterday, and place them in that box for keeping until we are able to classify them as a COVID death or a non-COVID related death.
Well, the mother of a 20-year-old woman who died at PMH with COVID-19 just days after giving birth is speaking out. Jared Higgs has her story.
9-month pregnant Shekinah Dean started vomiting blood 2 Sundays ago. Her mother knew something wasn't right.
When I called the hospital, they said that to bring her in.
But dropping her daughter off at PMH on August 16th would be the last time Karen Dean saw her daughter alive in person. The pregnant 20-year-old would endure a 10-day hospital stay that would involve the young woman testing positive for COVID-19, giving birth to a baby boy, and dying less than a week later.
Carrie is all yours. If something happened to me, God forbid.
Speaking to Our News via Zoom, the grieving 43-year-old says her daughter had a miserable hospital stay. Displaying symptoms such as shortness of breath and a dry cough, the woman says her daughter tested positive for the coronavirus and desperately wanted to be transferred.
She said, I wish I could go to Blake Road. I don't care, Mommy. I wish I could go to Blake Road. I want to come home.
Dean says she stayed in touch with her daughter with video calls during her hospital stay, and at times her daughter was showing positive signs of recovery. However, she describes a miserable state of care where her daughter was left to suffer with little attention from staff.
She would be knocking on the wall to get the nurses' attention. The nurses would take forever to come to her if they ever come to her.
The Oaksfield resident says she tried to send water and juice for her daughter, but nobody from the ward came to collect the items, despite her son waiting 2 hours to deliver them. She recalls getting word from the hospital on Wednesday that Shekinah died even after staying up all night, encouraging her to fight to live.
I'm devastated. I am broken.
The young woman's death comes as senior doctors warn that there is no more space in the country's healthcare facilities to treat COVID-19 patients. Dean, a security officer by profession, believes her daughter could have lived had she received proper care. She says the only comorbidity her daughter suffered from was obesity. Her death comes before she even had a chance to get to know her child.
She didn't get to she didn't get to see her child. She didn't get to spend no time with her child. She had plans for her child, and I would never dream in a million years that would have happened.
Dean described her daughter as the life of the family, who had a great sense of humor. She says the 20-year-old had plans for her child.
I have mixed feelings. I wanted to share this moment with my daughter. She died alone. I couldn't see her. No one could physically be there with her. We did everything together.
Our News reached out to officials from the Public Hospitals Authority for comment. They say the matter is under investigation. Reporting for Our News, I'm Jared Higgs.
All right, thanks, Jared. Well, the Consultant Physician Staff Association is tonight expressing concern over the amount of space left in public healthcare facilities to isolate COVID-positive patients. The CPSA president says given the lack of space and resources, there is no room in the inn.
We are now at the place where there's no room in the inn at our hospital as it relates to COVID patients, and in some instances, not even for patients who have other conditions, and that is concerning.
The CPSA president says there's simply no more space to house people who need to be hospitalized due to complications brought on by COVID-19. With isolation a necessity when treating these patients, Dr. Pinda Butler says she's concerned not just for the well-being of other patients, but healthcare professionals who interact with them.
Because at the end of the day, we want to provide quality healthcare. And if we don't have the space and then we don't have the staff, it's a very scary situation.
Another concern for this group of physicians, the number of people dying after having contracted the virus. 50 people in the country have died from COVID-19. And while that number may be small compared to the over 2,000 cases, Dr. Pinda Butler says the number is worrisome.
When we see that lives are being lost, that is a serious concern. We know that we would have already lost a physician in the first wave, and we recently lost a nursing colleague who worked alongside with our healthcare team. We have had other colleagues who've been exposed and are in hospital even now, and so this is concerning for us.
And with many businesses set to reopen on Monday, the CPSA president says she fears what's to come if business owners don't put certain measures in place and if Bahamians don't adhere to the guidelines.
We can do better in terms of our health. You know, we have a significant population with diabetes, heart conditions, overweight and obesity. So these are serious risk factors. So we are very concerned about the numbers of persons who have died from COVID, and also trying to make sure that we protect our healthcare team, because we don't want any other lives to be lost.
Prime Minister Dr. Hubert Minnis telling reporters this afternoon that the country will open back up in phases based on the number of active COVID-19 cases and hospitalizations. His comments come as some industries bemoan their continued closure.
We're putting together a phase opening, and that's being done not only by us, but that we have what you call a national COVID committee, which comprises of elements of the private sector, Chamber of Commerce, etc. And we're asking them to look at metrics, and therefore we know that once the COVID numbers at a certain level, then you can move to another phase. Once hospitalization at a certain level, you can move.
On Monday, Dr. Minnis announced that restrictions would be eased, starting with restaurants and other businesses being allowed to offer curbside and delivery services. Some questioned the timing of the decision, which was a complete about-turn from the week prior when the Prime Minister announced a total lockdown on New Providence without notice. That decision was quickly reversed. Still, the Prime Minister defended the effectiveness of lockdowns in slowing the spread of COVID-19.
The analysis would suggest that lockdowns were effective. And as you know, we still have continuation 10 p.m. to 5 a.m. That is when most activities occur in the Bahamas and most social gathering. So when you take your country into consideration.
Well, bus drivers staged a peaceful protest today, driving from Arawak Key to Arambeli Park, calling for the Prime Minister to allow them to get back to work. Jillian Gray reports.
80 bus drivers went on a motorcade today, petitioning the competent authority to allow them to operate. They say their customers are eager to get on board as soon as the Prime Minister gives the green light. Escorted by police officers, buses drove from Arawak Key to Arambeli Park. Corvell Colbrook, the Secretary General of the Bahamas Unified Bus Drivers Union, said his members are strapped for cash since having to park their buses in July. They are pleading with the Prime Minister to allow them to resume services when the country opens up next week.
The bus is for a small man. That is our mandate under the Road Traffic Act. We would like to continue our mandate, but something very important, we would like for you, sir, not to take us off the road again in the middle of the night like you did on July 28, when 7 o'clock the police stopped us and take us off the road. We're pleading to you, sir, to please to consider us, consider our family, and consider our customers who have to get up and walk to and from work in the morning or where they have to go to.
With sanitization measures in place, Coakley said they are ready to roll when the go-ahead is given. He also called the abrupt lockdown of public transportation in July disrespectful and appealed to the Prime Minister to talk to them in order to get a better understanding of their predicament.
We really felt disrespected when that happened. We would love to have a dialogue with the Prime Minister so he can understand the plight of the buses system. So you understand what is going on and the stuff that we need done in the bus system, so we will be able to operate in a safe environment.
Addressing the plea of bus drivers, Dr. Minnis announced today that different sectors would be opened in phases based on the number of cases and hospitalizations, which includes the transportation industry.
Bus drivers and everybody can just look at the phase of the metric and they know exactly what's being advanced.
Reporting for our News, I'm Jillian Gray.
Firefighters at Lynden Pindling International Airport are outraged after they say at least one colleague tested positive for COVID-19, but they were not informed. Bethany McDermott reports.
The Bahamas Public Services Union is sounding the alarm after leaders claim at least one employee at Lynden Pindling International Airport's fire station tested positive for COVID-19. BPSU President Kingsley Ferguson says employees and their union representatives were not informed or asked to take safety precautions.
What really caused our suspicions to be raised was we saw some things happening. There was some cleaning of the various trailers that these gentlemen occupy while they were at work. Some high cleaning and stuff was being done, but in the face of all of that, these gentlemen were not being informed of what was going on. And so these gentlemen were actually going home to their families.
According to Ferguson, this is not the first time a situation like this has happened at the airport. Firefighters slammed the airport authority's silence on the matter, with leading firefighter Calvin Stubbs calling it disgraceful.
We feel that it was a disgrace. We feel that it was terrible. We feel that it was known to management and persons that are who are in charge of airport authority with having to withhold information from firefighters who has to go home to their families.
Leading firefighter Michael Ambrister lamented the move, adding that his wife and children are also at risk.
In this life, if you don't look out for yourself, you're in trouble. See, it's on us now. We have to take our own responsibility to make sure that our family is safe. You see what I'm saying? See, now I got to go home. When I go home to my wife and my children now, I got to isolate myself from my wife and my children, because now I'm saying now I don't want them to get infected.
Airport Authority General Manager Milo Butler III said he is only aware of one employee testing positive for COVID-19. He said employees who had contact with the individual were advised to take the appropriate steps. Butler added if the union knows of any other suspected cases, its leaders are obligated to share that information with management so that the appropriate steps can be taken. This as the BPSU president called on the airport authority to find the resources to ensure that all employees are tested.
Send these persons to Dr. Fox so that they can be tested at the expense of the airport authority, not at the expense of these individuals. Families are hurting economically in this country, and so to go and find monies for something that is not really their fault is a slap in the face.
Reporting for Our News, I'm Bethany McDermott.
More news on the way, but here's a first look at weather with meteorologist Greg Thompson. Good night, Greg.
Thanks, Kyle. I'm meteorologist Greg Thompson with your first look at weather, being brought to you tonight by Downing. Currently outside our studios, we have just a few clouds, temperature of 86 degrees Fahrenheit. The winds are out of the east-southeast at 5 knots, with a feels-like temperature around 92 degrees Fahrenheit. On our satellite, An east to southeasterly wind flow with partly cloudy skies and warm conditions continue around the islands, with just a few isolated showers occurring. Those showers will weaken as the night goes on. That's your first look at weather. Your extended forecast is still to come.
All right, thanks, Greg. Still to come, the Prime Minister defends Dorian recovery efforts. Plus, roadside vendors react to government assistance. Stay tuned. Opposition leader Philip Davis, who tested positive for COVID-19 2 weeks ago, has been discharged from a U.S. hospital. PLP Chairman Fred Mitchell said in a statement that Davis was released from Emory University Hospital in Atlanta last evening. A video recorded by his family shows Davis leaving the hospital with his daughter, Dr. Philippa Davis, who is a critical care physician in the U.S. On August 16th, Davis confirmed that he had tested positive for the coronavirus and was admitted to hospital. 4 days later, Davis announced that his family made the decision together for him to travel to the U.S. to be close to his daughter as he completed his medical treatment. Mitchell said the PLP leader is looking forward to returning home. Well, days before the country marks the one-year anniversary of Hurricane Dorian, which ravaged Abaco and parts of Grand Bahama, Prime Minister Dr. Hubert Minnis is applauding recovery efforts.
I am very, very pleased with the progress that's being made. I think you would be very, very surprised when the ministry does a one-year report, and you would see, I think the entire Bahamas would be extremely shocked.
Abaco and Grand Bahama were pulverized by the monster storm nearly a year ago to the day. The storm's official death toll stands at 74, but hundreds more are missing. Back in May, government buried 55 unclaimed storm victims. Families protested the funeral. Well, the emotional scenes reminding all of the storm's major impact. Government's recovery efforts have been criticized, but Dr. Minnis says the storm posed an unprecedented challenge.
The unfortunate thing is in the Bahamas, we feel that everything happens overnight. A hurricane occurs today, and then the following day, we want to be back in business, we want everything back to normal, and it takes a while.
Grand Bahama was also tortured by the storm as it hovered over the island for hours. Residents of that island are recovering from the effects of successive hurricanes. Many on those islands are still struggling. However, the Prime Minister says there are positive signs.
When you look at the progression that they've made and compare with other countries around the world, taking into consideration they were hit with the worst hurricane ever. So I think you're going to see a new Abaco and a new Eastern Grand Bahama.
Well, roadside vendors who had a tough time selling goods during the pandemic are reacting to the Prime Minister's announcement that the government is looking to provide some of them with grants and a safer means of operating. Berthany McDermott reports.
And as the Prime Minister recently announced government's intention to provide grants for street vendors, vendors we spoke to today said the news is welcomed, just as long as the Prime Minister keeps his word.
It's a start, you know what I mean? It's like saying, but I mean, it's a good thing if they ain't gonna try and get too involved in it and make it too red tapey, you know what I mean? It's like saying.
I feel like you make a good decision. I feel like that's a good decision once he keep being money where.
I feel really excellent about that. I feel really, really good about that because it shows that that our Prime Minister has a heart. Our Prime Minister have compassion for his people.
Over the summer, police pledged to crack down on roadside vendors, some of whom were arrested for selling their goods without the necessary permits and breaching COVID-19 orders. However, on Monday, Prime Minister Dr. Hubert Minnis said government will make a way to bring street vendors into the formal economy and offer grants for many of them to improve their operations. This vendor said with a child on the way, he took the risk of operating because it's his only means of making money.
It was like a little setback because we still had to come out even though they run us. We still end up coming out. Still end up trying to make something happen. DeLon Lang and priest Otis Thomas, who both set up shop outside the Rasta camp selling fruits and vegetables, said operating outside their home hasn't been the same.
But he ain't been too happy, as I say. He ain't been too bright, you know what I mean? Or some might say my basket was empty, you know?
Just like everybody else, it's been real down, you know. The seeing you know, that's my son and that's my daughter right here too. So with mouth to feed, yeah, it's really down, you know. And where national insurance and social service concerned, yeah, they wasn't really doing nothing on our behalf.
But not every vendor had the same experience. Deandra Dorset is a jack of all trades, selling perfumes and soft drinks as well as offering services in house cleaning, car washing, manicures and pedicures. During the pandemic, Dorset said she was able to rely on her savings.
What I've done in that time, on a time I've saved, and then the resources that the government offered, like the RAP Bahamas, you could go to social service and different stuff, the number of office, the number of services that they offered during this time and the help in that NIB was perfect.
Reporting for Our News, I'm Berthany McDermott.
Still to come, the Port Authority spends $3 million to assist Grand Bahama businesses. Stay tuned. The Grand Bahama Port Authority has spent nearly $3 million helping small, micro, and medium-sized businesses recover from the devastation caused by Hurricane Dorian a year ago. According to officials who say the financial support was crucial as nearly 70% of those businesses were uninsured or underinsured. Jasmine Brown reports.
Exactly 1 year ago, Hurricane Dorian was churning through the Atlantic, slowly making its way towards the Bahamas, where it caused more than $3 billion worth of damage to islands in the north, according to the Inter-American Development Bank. Grand Bahama was one of the islands that was hardest hit, and according to GBPA Manager of Business Development Derek Newbold Sr., many businesses were severely impacted.
You know, in the wake of Hurricane Dorian, we dispatched a number of teams throughout the city of Freeport to conduct assessments, specifically of the business community, to see what condition they were in. And what we found was actually quite startling. Most of the businesses, especially the small and medium-sized enterprises, simply didn't have insurance. And they suffered some devastating impact.
In fact, the post-Dorian assessment revealed that nearly 70% of the licensees were either uninsured or underinsured, and 55% suffered significant damage due to flooding. Given the startling statistics, Newbold says the GBPA decided to assist by offering grants. Last year, the GBPA created the RISE program, a partnership between Mercy Corps, the American Red Cross, and Bacardi Limited, which granted up to $10,000 in aid for those who were impacted by Dorian. Newbold says hundreds of small to medium-sized businesses applied for the program that ended this summer, and more than $2 million was given out.
100 applicants in total, and we issued about 256 grants in terms of awarding grants to different businesses at a value of almost $2.4 million.
$500,000 was also allocated for grants for micro businesses.
This program provided grants of up to $6,000 for micro businesses, businesses that may have not had a business license, but were operating under a vendor's permit. And we received about 25 applicants or applications to that program. And we awarded 104 grants at a total value of just over $450,000.
The GBPA executive says as a result of the grant programs, hundreds of businesses were able to keep their doors open and more than 1,000 jobs remained secure. Reporting for Our News, I'm Jasmine Brown.
All right, thanks, Jasmine. Still to come, Ship 242 donating groceries to families in need. Stay tuned. A local shipping company lending a helping hand to families in need. Since Monday, Ship 242 has been packing big bags of groceries for those who have stumbled upon hard times. The company's owner, Sabrina Knowles, says they were one of the fortunate companies allowed to operate throughout a large portion of the pandemic, so they saw it fitting to give back.
I said, hey, you know, what would be a good idea is maybe we should at least give enough grocery. And that's what we came up with these grocery bags for a family of 3 to 4 to feed them for 3 to 4 days. You know, if the country gets locked down again this week, and even if it doesn't, people are still in need of food.
200 bags filled with food and toiletries have been handed out. People lined up outside the store's Harbor Bay location from as early as 4 a.m. in hopes of getting food supplies.
Started with an ad on Facebook, and then I also work with a few charities, and I send it to the persons in charge of those, and they said that they had people, and those people showed up, and it just kept catching on. And all week, to be honest with you, we had people out there since 4 a.m. some mornings waiting for bikes, and it was heartbreaking. But we're also glad that we were able to give back to the community.
And that's a look at news. We throw it back to meteorologist Greg Thompson for the extended weather forecast.
Thanks again, Kyle. I'm meteorologist Greg Thompson with your second look at weather. High pressure ridge continues across the area, and that will persist through the weekend, providing us with quiet weather and warm conditions around the islands. Chance of a few isolated showers and afternoon thunderstorms will exist throughout the weekend. We also continue to watch the tropics as 2 tropical waves continue to move across the tropical Atlantic, with just about a low chance for formation during the next 5 days. Your boating forecast for the northwest Bahamas and the central Bahamas tonight through tomorrow: southeast to south, 10 to 15 knots, seas running 2 to 4 feet over the ocean, while in the southeast Bahamas and east to southeasterly flow continues at 2 to 4 feet. Here's a look now at your national forecast. And now we'll look at your extended forecast through Wednesday. That's a look at your weather. Make it a great night, everyone.
Thank you for joining us for Our News tonight. On behalf of the entire team, I'm Kyle Joaquin. Remember, you can catch Our News on the go with the Revigo Play app. Have a good Friday evening, Bahamas.